Hi, my name is Roxanne Lewis. I'm a 43-year-old African-American female. I was diagnosed with stage 4B Hodgkin's lymphoma in December of 2010. I was actually in the ER in July of 2010 when the ER doctor told me in a not so good way to follow up with my primary care doctor because he asked me had I been bit by a tick. I told him no, because I hadn't been. He said, well, you might have cancer. And he proceeds to walk out the room. Thank God my best friend was there with me, or else I don't think I would have made it. Then October of the same year came around, and I was still having those stomach pains, and I was like, this isn't normal. So I went back to the ER, and the doctor who had read the x-ray before said that, he said, you have a hernia, but there's also a lymph node that has gotten quite a bit bigger since the last time you had an x-ray. And so he said, well, take care of the hernia, but we would like to go ahead and do a biopsy of the lymph node. And so he removed 2 out of my inner groin area, and it took a while for them to get back the results. I'm not sure why, but it seemed like it took forever. And he told me, he said, you have Hodgkin's lymphoma, which cancer doesn't run in my family. So I had no idea what he was referring to when he said Hodgkin's lymphoma. And he said, it's a type of cancer. He said, it'll interrupt your life for a while, but you'll get through it. From there, it was like a whirlwind. Go here and test, go there and see this doctor, so many tests, so many doctors, so many pre-chemo testing that had to be done. One thing in hindsight, looking back, I wish I would have had a choice. Stage 4B cancer, I mean, that's like giving you a death sentence. So whatever he said to do, I did. But it just took away my options. When I know, now that I know better, I think I would have made different choices. Like the place where I had my chemo, I love my doctor, I love my chemo nurse. It was like a huge room with like 20 or 30 people sitting there getting their infusions. And it just, every time I went in there, it just made me sick to see what this disease is doing. Before I had cancer, I literally had doctors before stand at the door like, okay, I got 4 other patients to see this hour. You need to hurry up and tell me what's wrong. I need to take your temperature, take your blood pressure, and get out of here. But my oncologist, he actually came in. He wore a suit all the time. He looked, like he was going to a business meeting, and he would come in, take his jacket off, fold the jacket across the seat, sit down, cross his legs, and have a conversation with me. And I just asked that, caregivers, not particularly family members, but like doctors, nurses, the aides, even the people who clean up, treat that person with the same respect that you would want your family member treated with.
Our final segment in this first plenary turns from counties larger than states to zip codes caught in the urban crunch, neighborhoods that have challenges that can seem as insurmountable as towering mountains or vast stretches of uninhabitable prairie. Focusing on one section of Louisville, Kentucky, a city that has been vaulted into the headlines with the death of Breonna Taylor and the social, legal, and political implications of her death. C-TAC has begun a project to unite the spiritual community and government and nonprofit organizations to bring relief to those in most need.
Faith leader engagement, community-based organizations, clinical supports, funders, and their intersection is a necessary component to exceptional healthcare. If we do not intersect all involved for all concerned, we will not reach a qualitative life for those who are enduring illness. Faith leader engagement is a must, particularly in this moment of COVID-19 and the state of our nation. My name is Angela Overton, and I have the greatest privilege of being the senior advisor to the Interfaith and Diversity Work Group, where the co-chairs are Rabbi Richard Address and Reverend Tyrone Pitts. Amid COVID-19, C-TAC has launched a pilot project in Louisville, Kentucky, in partnership with project leads Reverend Adrian Baker, an associate minister at Christway Baptist Church, and Pastor Alma Woolley of Christ Cathedral of Praise. Both places of worship are located in one of the most impoverished zip codes in Louisville, Kentucky. And our goals is to, one, understand their vision for care for those with serious illness, especially during this time of COVID-19. And based upon the completion of needs assessment, that's number 2, we are helping connect with resources that can be utilized in addressing those needs, not tomorrow, not 6 months from now, but right now. We hope to, number 3, at the end of this project, provide a model of care that provides tangible supports and administrative help to inspire and provide templates for other communities in our network to adopt.
Thank you, Elder Overton and the C-TAC family. What has been so vital for my congregation and my community. The needs of our faith community have compounded rapidly and exponentially because of COVID. Being in a food desert, the access to food has put us at an even greater distance from those that need the most care. And so we've had to make sure that some of the most essential needs were addressed, like food, transportation, things like that. And so C-TAC has allowed us to broaden our scope and also to try to fill in those gaps that were needed and also alleviate a lot of the pressure that was on our volunteers that were trying to do it out of our limited resources. So we're thankful for that.
First of all, let me say thank you for allowing me to be here with you all today. And that through the efforts of C-TAC, we have been able to meet the needs of more people than what we have done before. And just as Reverend Baker mentioned, that in times like these, when there is such a lack, we have been able to feed more, to clothe more people, to supply essentials to more than ever before. And so my congregation and I, we have been, this has been the busiest time for us, and we are enjoying every bit.
And so I'd like to ask both of you, what are the experiences of the folks in your community facing serious illness? And how is it for their caregivers?
Just looking at the people that we encounter and the lack of health care that some of them do not have, the lack of essentials, just lacking in so many things. I feel that when we look at the homeless, we understand that for many of them, they do not have health care. And so we are there to try to provide for them what we can. And through C-TAC, we have received a lot of resources that now I can share with them as well. For my congregation, because of social distancing and just being a part of this ministry, where this ministry is hands-on. And we love being where the people are in need. But because of COVID-19, we're trying to still do the work of the Lord by still being as safe as we can. So we see many people that we encounter, they do not have masks. They don't have the PPE. And so we're out there, we're wearing our masks to protect them. And so we have to make sure that they receive the things that they need in order to protect themselves. And it also protects us when we encounter them.
I have to say that the food insecurities were major for our elderly and those that have advanced illnesses. Because of the public transit system pulling back routes and things like that due to COVID. And again, everything is compounded now. But we also have to address and acknowledge that our system of which we live, systemic oppression is also a contributing health factor. Now, people are dealing with isolation, severe isolation from not being able to get to the things, not access, and not being able to be around people. So the severe isolation, the lack of transportation, our community needs much mental health care. And so these are the needs of my community.
Many times community-based organizations come in with a preconceived notion, but I know that it's critical, and I know that you both agree that we align ourselves with the congregation's mission. So how does a serious illness relate to your congregation's mission? And how does it relate to the community you serve?
At Christ's Way, we have a three-pronged objective. It's that God be glorified, saints be edified, and there's a salvation appeal to sinners. So we don't do anything unless those three things are met. So God be glorified. When we talk about the sacrifice of the brown-skinned Palestinian Jew that we serve. So when we talk about that sacrifice, we also have to pick up our cross as well for our community. The saints be edified, that second piece, that those inside of our congregation, that they always are being made bigger, that they are always being augmented. And so this is a way in which we model this for our other members on how to care for others, on how to give back, on what the church is supposed to be doing. And also it's been a model for other churches that want to partner and things like that, that you all are doing the work, we want to get them part of that work, and they are connecting with us. And it's just a beautiful thing.
I'd like for you to take a moment and share with organizations, with our audience today, healthcare organizations like C-TAC or clinical and community-based organizations like C-TAC, how is it appropriate? What's the most effective way of engaging faith communities, faith leaders?
Don't talk over us, don't talk underneath us, but just talk to us. We want to have a welcoming relationship where both sides understand that we each have something to give, and that in this giving to each other, we want to become a partner with one another. And so I believe that if we want these things to work within the Black community, you have to meet us where we are, and have a mutual understanding of we may be a little different than what you have encountered before, but be tolerant of our the things that we do, even the things that we believe, the way that we worship, the things that we may say. You have to be tolerant of all of those things.
How do you see us working together through our experiences of systemic racism? How do you see us getting through this, especially as it relates to healthcare?
Well, let me just say that when it comes to racism, it's nothing new to us. We have always been a part of that. It's nothing new to any African American here in the United States. And so when it comes to racism, because we have grown up in it, many of us have experienced it in one way or another. I think that it's not necessarily the African Americans who have the issue with racism, but it's those who want to encounter us, who may think that there may be some type of difference that cannot be handled. But we have always adjusted to our environment, whatever that may be. And so as you come in, and it's very important, for instance, with C-TAC, Elder Angela, you came in and you've been a part of it. You showed up, you talked to the people, you communicated with them, you laughed with us, you know, we did some fun stuff together. And so with those type of relationships, that's what brings us together. And so, you know, we look at racism, it's nothing new. It's just something that we have learned to, we adjust to it because we understand that it has always been like this, you know, for us here. But we just want other people to understand that come in and just present to us whatever it is you have. We are open, we'll want to be welcoming. We want you to know that we desire, you know, whatever it is that you want to share with us, we want it because we feel like we deserve it. We want it. So just bring it to us, just introduce it to us, but don't be afraid. Don't come in and be standoffish, but come in and join in with us, and let's do it.
When we talk about systemic racism, let's not look at racism as far as incidents. Let's look at systemic oppression as far as system. And so the inequities in healthcare, education, houselessness, the environmental health. We talk about in our city, we're one of the highest segregated populations in America because we were relegated to spaces that were environmentally not safe for people to live. We have to make sure that when you come in, that entry point, that it's a two-way street. It is acknowledged that yes, we are here to try to mitigate as many inequities as there are. So here at Christway, at Christ Cathedral of Praise, we're committed to doing what we can. We call it balling on a budget. If we don't have nothing but a shoestring,
That's right.
We are going to try to make sure we can do what we can with it. So make sure when there's organizations that want to be a part, that want to partner, realizing that there's inequities in healthcare, education, and all those things. And those things need to be addressed from the outside in.
It has been a labor of love. And C-TAC is with you, for you, and around you.
We thank you for being with us today and know you become fully engaged in the sessions and labs to follow. Please make sure that you take a few moments to visit the virtual exhibits that have been created by organizations that are supportive of the summit through sponsorship. I will be back at the end of today's summit presentations to welcome Stephanie Anderson from Respecting Choices and to wrap up day number 2.